Hello and welcome everybody to another episode of the Evolving Practice Podcast. I'm here with my co-host.
Hi, everybody. I'm Dr. Sean Carey.
And I'm Dr. Bill Moss. And this episode, we're going to go into non-traditional instances of success with healing within the chiropractic profession. So, we did an episode a long time ago, a while back, about kind of the ins and outs and the deeper understanding and knowledge of what chiropractic care and what it is. But today we wanted to talk about some of the non-traditional cases that can and are often helped with chiropractic that are beyond the traditional ones that people typically see and talk about, such as just back pain, neck pain, headaches, that sort of thing, and go a little bit deeper into some of the personal success stories that we have had and the conditions that we face on a regular basis that many people do not know, because the breadth and depth of chiropractic healing goes way beyond what many people know. So we're going to explore that with you today.
Yeah, chiropractic has so many benefits for so many different types of conditions, and oftentimes it's one of the things that we get asked for. People are like, can chiropractic help X or Y or Z? And one thing we always have to kind of pre-frame is that the reason chiropractic is so helpful for so many different types of conditions is because basically we're just treating the body as a whole. We're treating the nervous system, we're bringing the body back into harmony, and it simply allows the body as a whole to work better. So people benefit from it who have a wide variety of conditions. With that being said, there are some conditions that are really fun to work with that people might not associate chiropractic with. One that comes to mind right away for me is ear infections. I love working with kids who have ear infections. Before I started my own practice, I worked for another chiropractor, and he had been featured on CBS News for kids and ear infections. And so we saw lots of kids in the practice through that. And the success rate is extremely high for kids who have ear infections. And what we always end up doing is basically analyzing the upper cervical spine. If there's a problem there, it affects the muscle tone, which can interfere with the eustachian tube's ability to drain. So it's easy for fluid to back up. It's easy for things to get infected. And it's just something that, whether or not a child has ear infections, just making sure that that area is in balance and harmony is so important for the overall healthy development of the child, both in terms of just their overall physical health as well as the underlying neurology too.
Yeah, it's a miraculous and magical thing. Even my daughter, she's never had an ear infection. She's 5 years old now, and has been checked since birth. And worked with plenty of children, and it is one of those things where kids communicate very differently, right? So this is an important conversation. I feel I have often with parents, especially the ones I'm talking with kids. Kids don't raise their hand and talk about pain, right? Especially an infant. They're not giving you signs of like, hello, I would like to tell you about my neck pain and my problem with my cervical spine and how my sleep was. It doesn't work that way, but they show signs of crying, tension, a lack of sleep, colicky, and all these things show signs of maybe discomfort that they are experiencing, early stages of that, the symptoms of the ear infection. And it is amazing how efficiently they can clear up when we take care of them, when they're under regular care or get seen very efficiently is a good word, because kids are so easy to work with. I think the perception of pediatrics and chiropractic sometimes is that we are addressing and adjusting them in the same manner that we do with adults, and that's just not true. They don't require the frequency, the frequency, the chronicity. They just do really well when you get them started at a young age and get them checked quite often to help prevent and maintain that healthy nervous system and response, for sure.
Yeah. And one of the huge benefits with it is that the spine is still developing at that point, and it's so much easier to kind of guide the spine when it's in that developmental state where it's still growing, where things are still, it's built into the body at that age that things are just more flexible. They're constantly shifting. So for us, it's kind of like we're getting to guide the body into that optimal place of balance, versus waiting until somebody is older and they have those patterns well established. Their system doesn't nearly have the same flexibility or growth. So it's a lot harder to correct at that point. But I had
no, I was just gonna say it's very simple. It's like only most wild how
Mm.
how little it takes as far as it takes assessment, it takes precision, but
Yeah.
it also doesn't take much force. And it's always amazing how it unfolds and how the child sleeps and how they recover and what parents notice. And, they're really growing and developing. So they get to see how they kind of transition through each growing
Yeah.
step and milestone and how the body handles that development. It's really great.
Yeah, and it can have such a profound effect on the child's health. Like I'm working with a child right now who's had profound success with ear infections, and this little girl had terrible ear infections. She also loves swimming. She'd always get ear infections after swimming, but
Mm,
she was having 4 or 5 rounds of antibiotics a year. Yeah, and it had
mm,
been going on for several years, and like, I believe she had tubes too. It was just one of those, like, it was a horror story for the parents, where the child was just
mm,
chronically sick all the time, and it had been going on
mm,
for years. And since we started chiropractic, she didn't have a single ear infection, and now she's been under wellness care for 6 months, maybe. So
it's
like we're
awesome.
talking about a huge amount of time. But what that does for the developing child to not have 4 or 5 rounds of antibiotics a year, what it does for their
Hmm.
gut flora and brain health and all these other aspects of development, to
Yeah.
not have that hit on the immune system constantly because they're always sick. It can
Hmm.
really help the child to develop much more smoothly.
Hmm.
So yeah,
Yeah,
it's
it's
a lot of
amazing.
fun.
Yeah, I don't know if I talked about it, but one of the my senior project, I guess, my senior defense, if you will, we had to do a big like research project, and basically be able to defend it as a panel, as a group. And we had one person who was elected speaker, and then the rest of the team answered any questions that our professor came at us with. And my professor was Dr. Matt McCoy. He taught this class, and you know he he was a great teacher, really great teacher. But my group's topic was called Kiss Kid Syndrome. I don't know if
Hmm.
you've ever heard of this. KISS. So it was kinematic imbalances due to suboccipital strain, which basically describes an upper cervical subluxation, and then how KID, it stands for uh, kinesthesia induced dysnosia and dyspraxia. So it was basically like upper cervical, uh, yeah, kinematic imbalance due to suboccipital strain that leads to these sensory problems. So it was
Yeah.
basically an upper cervical subluxation and how it leads to abnormal sensory development in a child. And basically, what it was saying is when they don't get that healthy interpretation through the sensory part of the nervous system, they like miss levels of development in their
Yeah.
neurology. And that's why like a severe torticollis is so kind of detrimental to their growth. And I think the doctor was like Biederman, his name,
Yeah.
and he was out of
Yeah.
Germany, and basically was a medical doctor who justified all of this research on the importance of the upper cervical junction in a child and how it affects the totality of development. So I think that's another concept. Like people don't realize that the developmental progression of an individual child is very much related to the health and um, adaptation of the nervous system, which happens through the spine.
It's funny. I don't think you and I have talked about this much before. I've talked about that in a different form, where talking about children with autism and ADHD, but talking about the same thing, as far as one of the most
Yeah.
important things for brain function is, and there's great research on this.
Mhm.
And even there's an academic text that comes to mind, where it's a text about, for basically like PhD education students, for teachers
Mhm.
and professors, talking about how the nervous system learns, and the very base is the health of the central nervous system. Then we have the vestibular system, proprioception, the awareness of where the body is in space,
Mhm.
all these things, that it's basically what the upper cervical spine is firing into the brain. If you don't
Mhm.
have that as a foundation, it's so much more difficult to have healthy expression of higher levels of development with the brain. So talking
Mhm.
about things like hand-eye coordination, talking about things like the ability to write and speak, and the ability to have healthy coordinated movement. Like,
Mhm.
it really depends on those healthy developmental milestones being hit, which
Mhm.
comes from one of the things that propel the developmental milestones forward is movement. So like when a
Mm,
child learns how to pick their head up to or start crawling, it's engaging different movement. It's triggering different neurons, causing them to fire, which are then going to the brain, and that stimulates a whole cascade of development. But
yeah.
if that process isn't happening correctly, because the area where you get the most input is from the upper cervical spine, if that's not happening correctly, you can really miss significant aspects of healthy neurological development.
Yeah. I mean, that's really good. I'm glad we went there. It's complex, but that is so important and so foundational. And it's so much easier to I think that's the thing I try to communicate. Like it almost seems too simple sometimes
Yeah,
when you work with children because it doesn't have the level of complexity from a structural and fixational and a pattern, built up into the
yeah,
system of the individual. And problems within the physical structure become kind of amplified if they're never corrected at a younger age. A lot of our problems that we see as chiropractors, though things show up maybe within a few weeks or months or whatnot, there's been a underlying kind of breakdown that's been going
yeah,
on typically for an extended period of time. And most of the time through a good consultation, we can really actually uncover that to understand when something started, when an abnormal pattern started for an individual, and how they kind of got to the point that they did. But a lot of that can be course corrected at such a young age
yeah,
because they just don't have, the buildup, the calluses, if you will, right, that
yeah.
we get throughout life by wear, tear, and use, and lack of kind of self redirection and to help our body heal over that time. Or yeah.
I love it. So what's another condition that comes to mind for you as far as thinking about things that you wouldn't people wouldn't necessarily associate with chiropractic?
Yeah, I mean, I think one that is a little more mainstream that people know about, but oftentimes people come in and they're like, "Oh, I'm dealing with neck pain," and then or I have some back pain, and then they're like, "Oh yeah, I also get migraine headaches from time to time." And you're like, "Why isn't that at the top of your list? Like, how often do you have these?" "Oh, a couple times a month they lay me out." And I realize people actually don't have an understanding that this is something that we tend to work with. Me as a
Yeah,
person who kind of upper cervically focused, that's in probably the top 3 conditions that I tend to work with, and I would say get my best result with. Um, I enjoy that challenge. A lot of headaches. I think it's even the research is like over 80% of headache-like complexes have a a cervical spine component to them.
yeah,
And there's almost like an understanding in culture that though it might be common for someone to have a headache, it's not normal to have headaches. And I think when people have them for extended periods of time, we normalize the fact that like they
yeah,
have that dysfunction. And
yeah,
whenever somebody gets to that point, I'm always a little like sad that you've decided that that's normal, because it doesn't necessarily have to be. So I think migraine headaches and migraine variants, ocular migraines, that sort of thing, there's usually a nervous system component. There can be other factors, no doubt. And there's other factors that can be triggers to them. But at the end of the day, it is something that we see really good results. I know all chiropractors
yeah,
see really good results with that, just because if somebody has a little bit more knowledge of the head and neck, they tend to seek me out to some degree. So, um, because I work with that intimate area a little more in detail.
yeah. Migraines are, yeah, they're so interesting because they can be so individual as far as like there's many different
Mhm,
types of migraines, but
mhm,
they respond for the most part. Migraines respond really well to chiropractic care, especially with that
mhm.
upper cervical focus. I really enjoy
Yeah.
working with as well. My dad suffered from migraines terribly when I was a child. He broke his neck when he was younger,
Oh
and
wow.
so he would have terrible migraine headaches where he was debilitated for days at a time when I was growing up, and we couldn't have like the lights on.
Mm,
He was severe migraine case,
mm,
and yeah, being able to go to chiropractic school, and then I started working with him, and he had a lot of success with it. One of the things we
mm,
incorporated too was some different cranial work. So sometimes I'll
mm,
add that in with my my headache patients.
Yep.
And kind of on that same vein, another thing that I think people don't necessarily associate chiropractic with is TMJ, where the
Oh, yeah.
TMJD,
Yeah.
where basically the dysfunction of the TMJ joint, there's such a huge relationship with that in the spine. So
Mhm.
often we'll see that when there's an imbalance with the spine, it's affecting the muscle tone through the head and face. The
Yep.
nerve system's irritated. The person's more prone to grinding their teeth. So that can lead to damage of the teeth, but also certainly affect the TMJ joint.
Yeah, without a doubt. I see that a lot, especially people have like a list or lean in their
Yeah,
neck. And, you start to see how you look at it enough head and necks, you can see how it's all, compensating together. But yeah, that's a big one. And I would go as far as saying, there's certain conditions I have definitely seen an uptick over the course of the last couple years, and one of which is 100% TMJ. I've had a lot
yeah,
more clients who and I feel like it is more. I don't know if my website just deals it better, but I've been getting a lot more people that are coming to see me directly because they are actually having that issue along the
yeah,
way, and they're like, you look like you might be the one to be able to help me with this. Um, but I feel like because of the stress and the way people grind their teeth when they're sleeping and that sort of thing, I've definitely seen myself caring for many more individuals over the course of the last couple of years with the TJ condition, and I do feel like I get very consistent results with that one. Where there are some other cases, I'll tinnitus or ringing in the ears. Um, I've helped many people, but it's very inconsistent as far as who gets
yeah,
results with that one for me. And I know it's like there's for every person that gets well, there's some people that don't respond the same way. Not nobody's profile or
yeah,
response to years of life are the same. So there are various results, but that has been one for me, the tinnitus, where I've definitely seen it change and get better, but not as high a percentage as like the TMJ and the migraine headaches.
yeah, yeah. I'd agree with that. And then another condition that comes to mind too, which how one of the things that you really benefited from was chiropractic and anxiety. And it's something that I
Oh my
really
god.
love working with, where there's just people wouldn't necessarily associate it with chiropractic, but the vast majority of patients who I see who have anxiety have a significant level of improvement with it with chiropractic care.
100%. One a
And
hundred. Yes.
yeah,
It's another one of those that on the sheets, it's like I don't know if you ask about that kind of background at all on your intake,
yeah,
but we definitely have a section, do you suffer with anxiety, depression, like any mental health kind of things? And I would say 50% of the people are checking depression, anxiety,
yeah,
and maybe that wasn't the start of health issues, but it does accompany so many this day and age. People
yeah,
struggle with mental health in so many ways, but motion, physical exercise activity is so helpful for releasing like emotional energy. And when we start to work on the spine, man, I mean, people's emotions free up. They some inertia in their body. They get more movement in their spine. They tend to feel a lot better. And I discussed my story at the beginning of the podcast, one of the episodes, but I suffered from debilitating anxiety to the point where my heart was racing. I had high blood pressure. I was having dizzy spells, and it would happen to
yeah,
me every day, very randomly. Uh, and chiropractic, I took medicine. I did had an emergency medication, I think lorazepam, and then I took Zoloft for an entire year, and I had good response to chiropractic even during that time. I seemed to like feel calmer in my system. And people do that. Chiropractic brings us back into like our present moment of our body.
yeah,
It brings us back into the physical state. So I experienced that. And once I got under regular care, I mean, that's the thing I wanted to go away. Like I thought at 22, I'm like, am I gonna live this way in this state of
yeah,
panic, fear, and chaos
yeah,
forever? And now it's am I never anxious? No. But do I have tools to manage it? Yeah, without a doubt. But it's a huge one that I see people change all the time.
yeah. And just getting that baseline down, like if somebody's that baseline level of anxiety is really high, and we can get them more
Yeah.
comfortable in their body, And just to
Mhm.
go into this a little bit more as far as the science behind it,
Sure.
and when the spine is misaligned, it's very irritating to the nervous system. So
Mhm.
think of, if for a moment, if imagine that your brain and you're trying to keep this being alive, and there's all sorts of threats around all the
Mm.
time. One of the most important things you need is accurate information from the body about how the different
Mm.
organs are working, as well as where
Mm.
things are in space. So where the hands are, where the feet are, which muscles are tight and contracted, and those things. So your brain's making all these calculations at once. When the spine is misaligned, it causes basically misfiring, or what we would say disaffrontation is the technical word
Mhm.
for it. But it causes this misfiring of the nervous system, and that's extremely agitating to the brain. So basically, these things are firing that shouldn't be firing. It puts the nervous system in a state of agitation, and then the way we typically perceive that is through like anxiety. It's a tenseness feeling.
Yep.
That's one of the reasons people love getting chiropractic care, is because they feel less tense afterwards.
Mhm.
So there's that mechanism, and then another mechanism that is that chiropractic can really help improve the overall motion and mechanics of breathing, is by releasing any tension in the thoracic spine, so that it's easier for somebody to take a breath. Just having
Mm.
those proper mechanics. So as that rib cage is able to expand more fully, it's easier to take that deep breath in. And this is all happening
Yeah.
unconsciously, but what people feel like is it's like, oh, I can take a deep breath. I'm less
Mm.
anxious. And
Yeah.
the success rates are very high.
Yeah. Well, and I describe it to people like if you're driving your car, um, you can get to the stoplight, the red light, and you could have the gas on and just continuously apply the brake and still have the same amount of gas, and your engine's going to idle high. You stop the car, but the car's still idling very high because you kept the gas on. And that's kind of what happens is people get stuck in this state of like racing and overdrive, where their nervous system's in that like fight or flight, sympathetic
Yeah.
overdrive. And even they'll be exhausted at night and they'll fall asleep, but like they're still the gas pedal's kind of on, right? And
Yeah.
they're idling high. And when you do that, you're 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 at a higher tipping point, right? If
Yeah.
people, I always like James Chestnut's like backpack analogy. Did you ever hear that one?
I
Where
never
it's
heard that.
like if you have a backpack and your health profile is like weight inside your backpack. And if we keep loading you up with weight, at some point your body starts to break down. And it's like the health of an individual, that when it gets ill, it could be like an extra 5, 10, 20 pounds. And then at
Yeah.
certain point, it becomes this load on the system. And then you throw a little extra stress in, and then boom, it's like people's backpacks are so full to start that it just takes a little more stimulus in the form of stress to create more problems and more tension. So we're running around stressed out. We also aren't, you know, taking care of ourselves in many ways, internal and external ways. And it leads to this like heavy weight that people carry around, and then they just start to break down in many ways. So that's, I know for me, I wasn't living like healthy lifestyle when I went through these panic attacks. There were many
Yeah.
things that were out of sorts, and it wasn't like chiropractic uh, compensated for all those, but it did help me have some awareness. Like, I'm having lots of anxiety, and what I'm
Yeah.
doing in my life, I'm treating myself. But I put myself in this state of overdrive that I was just looking to get back to like this baseline level, like you said, where we just removed some of that weight so I could
Yeah.
have a lower set point that
Yeah.
needed less poking to go into
Yeah.
this full-blown state of panic. And that's one of the things that a healthy nervous system provides people. It like lowers that threshold where we can live with a little more, we can live into the ups and downs without a full-blown attack on our
Yeah.
health, right?
Yeah. That's such a beautiful analogy. And I had never heard that before, but I love it.
I
And
think it
yes,
was him. I don't know. I think it was James Chestnut. It always stayed with me. I was like, that's a good visual of
yeah,
what it's like.
it helps to have those. So because it just
Mhm.
really helps anchor those concepts, I think. And really, yeah, chiropractic. What we're talking about, there's a resiliency and there's an adaptability as far as the nervous system. So if
Mhm.
we can just, like, the one of the ways I refer to it is like a boiling point. 212
Mhm.
degrees of water boils. But if you can take that set point from being 200 degrees on the default to now it's
Mhm.
150 degrees, like you have a lot more room
Yeah.
before things boil over.
100%. That's a
Yeah.
great way to say it too. Yeah, it's good to know because people do understand all these things, and they almost
Yeah.
can look at their life and they're like, yeah, well, this got really bad when my
Yeah.
husband passed away, and then it
Yeah.
became more of a problem. Like people identify like the tipping points of when things got really bad, and oftentimes it isn't, a physical accident. It's a big life shift that we didn't know how to fully integrate.
Yeah.
And that happens. People get stuck in their physical bodies. Many of the transitions that we naturally kind of strive to move through, and people get stuck, and that's okay.
Yeah.
So anxiety and depression is one of the biggest sidebar things that people have. I had a guy today, and he ended up having a lot of vertigo, dizziness, and he had some neck injuries, and he just described it like he didn't have the energy, the life to even
Yeah.
work, and he basically kinda stepped away from his company, and only did it when he felt like he could do it, and we had his reassessment, like, a week ago or something, and today, this morning, we were just talking, and he was like, "Since I got on care," he's like, I just feel," he's like, "Something was a little off today," but he's like, "I just," and he got
Yeah.
adjusted, and he just was walking out, and he's like, "I my gut is better, my energy
Yeah.
is better. I'm not I'm not like just hoping for a good day. I'm having good days.
Yeah.
Looking at what I can accomplish as opposed to like I hope I can accomplish something." And he was telling me about all this, the breathing, his anxiety, his gut, his outlook, and
Yeah.
all I did was assess the spine and adjust the neck, and this is what unfolded for him. So um, there's so many things that are affected by what we do.
That I feel like that was me, when you were sharing that story with him, because
Mm,
I had such a profound response too with chiropractic that I simply wasn't
mhm.
expecting, and that ended up
Yeah,
leading me to go become a chiropractor. But I didn't. For you, it's the same way. It's not like there were family members who were chiropractors, and that's how we got into it.
no,
Or I
no.
had no exposure to chiropractic, and I had that profound healing. And when
Mhm.
I was maybe 20 years old and was like, wow, I feel a lot better. I'd like to learn more about this. Yeah.
I love that. And I had a gentleman, a chiropractor, observing my practice today, and he's going to do some coverage. And we were talking about, this concept of like people getting it or not getting it. And, I realized how my view of what that even means has
Yeah.
changed. And the reality is like, people don't really get a health change that they make until it directly affects them, right? It's
Yeah.
like, until people choose that they want to do a different thing. There's people I've taken care of for years. They could eat better and they could, and they choose to take Tylenol quite often and Advil every day. And like, but they come see me and they come get checked. And, it's like until they've said it's enough or they've embodied it or taken a new direction or tried something different, like a lot of times we just do it until we decide. I can't
Yeah.
decide for people. And I think a lot of times chiropractors want everyone to adopt like the quote lifestyle of like being more holistic. But like people are only willing to do it up to their level that they're going to do it. And then they're
Yeah.
actually not going to know or understand until they decide to give it a shot and see the difference, right?
Yeah.
No amount of telling embodies that, and that's why we became chiropractors is because of the direct experience. So,
Yeah.
and that's why we survived as a profession. It wasn't the science research; it was the
Yeah.
experience that people had. And it doesn't mean it's not important. It's just like what kept us alive through the ups and downs and attacks and everything is the fact that like people ultimately experienced fruits and results.
Right. Yeah. 100%. I have this family who I take care of. I saw them tonight, and one of it's three kids, three younger kids, and the son, when he's off, when his upper cervical spine is off, it's just such big behavioral issues, and the parents
Mhm.
always recognize it. It's like he was
Yeah.
playing, and then he's been, he was really rough and tumble. Uh, but then since then, he's been just kind of behaving erratically. So we wanted to bring him in.
Mm,
And people
mm,
start, like as they start to just understand this concept we're talking about a bit more, like it becomes more relevant in their own life. And so it's not an abstract thing. It's like, oh, my kid
yeah.
is like this, or my wife's
Yeah.
having headaches again, and
Mhm,
she wasn't doing it when she was under care. And
mhm.
so like then people can start to really experience it.
Yeah. Well, it's even yeah, it's so funny. It's like we were gonna talk about conditions that but we're talking about healing process with these conditions. And,
Mhm.
I sometimes it's good that people like walk away for a second. I
Yeah.
recently had 2 people this week. They just, you hit the holiday season, they kind of fall off and they come back. And sometimes when that happens, I'll maybe do a visit and then I do a quicker visit. That's
Yeah.
like say they were once a month and then they missed like 2 months. And then I do a 2 weeks back to back or, in
Yeah.
2 weeks. And I had somebody come back yesterday and she was like, she was worried. Do I need to go do this? Do I need to go that? I was like, why don't we just check you? You haven't been in for a while. Let's get you adjusted. Come back next week. Let's see how you do. And she was like, holy crap. I can't
Yeah.
believe like how quickly and they're like
Yeah.
redoing their house. She's doing floors and she was like, I can't believe how much better I'm doing. And what I did took on. She's like, I just didn't realize I wasn't here. And
Yeah.
it's kind of good that when people do that sometimes, because then they're like, oh, that's what this did for me. Um,
Yeah.
and
Absolutely.
I've even had that experience. Like this year, I've been way more committed to my own chiropractic care. Like
Yeah.
I had an associate years ago. It was easy to get checked. And then all of a sudden you're like, when's the last time I got checked? I've been just checking everybody else. And now I'm
Yeah.
put myself on like an every other week
That's
regimen. And I was sick a lot last winter. I've been so much healthier this year. Um, and I attribute that partly that I've been proactive in my care, instead of
well,
reactive.
yeah, it makes a huge difference. And I did the same thing. I took like a break too when I first got exposed to chiropractic. I had insurance at the time and went for 12 visits or whatever, and then I didn't have the money. I was a broke student, so uh, but then it was like I had this in my mind. It was like, oh yeah, the headaches are gone. It will be gone forever. But then I just
Mhm,
kind of kept living the same way and having the different bad habits. So the problems kind of slowly started coming back. And then it was like, oh,
mhm,
if I want to really have those benefits of feeling really comfortable and pain free in my body, then this is for me how I make that
mhm.
happen. Like there's
Yeah,
the routine to do that.
yeah, that's great.
Yeah.
Um, what are some, before we kind of wrap up, what are some, last conditions that you see? I have one more that I like to bring to mind, um, to light.
Hmm. Let me think about it. You say what's on your mind.
Yeah, probably another big one that's there's like misunderstanding and it's kind of an umbrella diagnosis is fibromyalgia.
Yeah.
Fibromyalgia is one that I get a lot of because one I love working with them from an upper cervical perspective because fibromyalgia is like I don't even know what the standard definition, but it's basically a lot of different pain points or tender
Yeah.
points on the body in various quadrants and regions. And sometimes it really shows up as like a neurosensitivity
Yeah.
problem where people are like overly trained to have a pain response, right? It's like
Yeah.
the more they've trained their body to be in pain, it takes less stimulus for someone to be in pain. And I've really seen great results because one, upper cervical chiropractic's conservative. Any specific
Yeah.
chiropractor that's using objective means is going to most likely be conservative, and they usually clients with that quote diagnosed condition tend to respond really well because if we're making these subtle changes to lower the threshold of the nervous system there we're retraining their body to like not just turn into a pain storm so quickly
Yeah.
because that threshold like we talked about that boiling point it becomes lowered so they don't just respond to everything in this form of pain so I kind of love that condition because I feel like though it can be delicate and a little bit tricky, I feel like I got really consistent results with people who've suffered with that quote diagnosis or
Yeah.
misdiagnosis, if you will.
I really enjoy working with those cases too. Like, and I just put it like as like a chronic pain,
Yeah.
the blanket chronic pain, because oftentimes there's multiple areas of chronic pain. And one of
Mhm.
the things that makes that really rewarding is that it really affects the brain. Chronic pain, like
Mm.
it leads to depression. It leads to it can really just put people in this altered state where the world just doesn't seem as bright and things are more difficult. And when you can help
Yeah.
somebody out of that state, like it's just such a profound shift for the person. And it's
Yeah.
always it's also interesting to work with because oftentimes there's so many different factors. So just a part of my brain likes to kind of be a detective, gets to
Mhm.
work on those things. But I really enjoy the chronic pain cases, and one of the things that I feel like helps me get success with them is actually doing like less. With the chronic pain
Yeah.
cases, I'll often do much less than a normal typical case,
Mhm.
and because their systems are just so they're so overtaxed already. Like that
Mhm.
aspect of precision of just doing that right amount of stimulus and then backing away and letting the body actually make the shift. It can
Yeah.
like it just people with chronic pain and fibromyalgia and those things, they tend to respond really well. Like it takes more time to do the approach, but also
Mhm.
doing less stimulus, and then giving the body actually a chance to relax and integrate.
100%. Yeah. Yeah, there's an art, each one of these conditions, there can be like an art to the care and the frequency and the understanding and what to watch for with the change. And, that's what I love over the years is kind of that working together to watch how somebody responds. And I feel like I'm hitting, you said this, I think on one of the podcasts, you feel like you're hitting this level of like kind of mastery in
Yeah,
some ways. And I feel like I'm having over the last couple months like really good results. Like
yeah,
people are doing really extremely well. They're on their reassessments. I'm never having somebody with like a fair result or change.
yeah,
Um, it's just been better and more efficient. And I think it's that subtle understanding of what it looks like to care for these different um, manifestations of symptoms within different types of people. And that's I feel like I'm almost enjoying working with people
yeah,
more in the last couple months just because of the conversation we're having here is like more in tune with the subtle changes on how to and what results I have personally gotten with people over
yeah.
time. Because that experience makes it a lot easier to be like, yeah, I can, expect to see a similar result based on similar findings. Yeah.
I love it. And then we still
Yeah.
get a lot of ways to go on this journey too. You
Oh
know,
my
where
gosh.
I think I graduated in 2011 from chiropractic school. I think August 2011. So
Okay.
I don't even know how long that's been, 13 and a half years or something like that.
Yeah. I'm March of 2012. So I
Okay.
was, like, I don't know, 8 months after you, whatever that is.
Yeah. And we
Yeah.
still have like a
Oh,
whole career ahead of us.
no, I know, and I was thinking about the guy who's gonna do coverage for me. He said he's been retired. He's been doing coverage for his old office that he sold, but he's been doing coverage for like 8 years, or he's been retired for 8 years. And I'm like doing the math and everything, and I was like, well, I practiced to that age. I was like, I still have like 25 more years of like just working.
Yeah.
And I have no idea how long I want to do exactly what I'm doing, but I think to some degree I always would love to care for people. And I think that's what he
Yeah.
realized, and I think that through on the show and, for our listeners to know is the reason we're doing this is, and I've already had people coming to classes and coming into utilize different services because they've actually heard the podcast and had
Love it.
some deeper understanding about what we do. Because there's so much to know about this, and in
Yeah.
visits we can't really communicate the breadth and depth. So I look forward to even sharing this episode with my chiropractic clients and others who are like, don't know that much and want to know more, if this would be a feasible way for them to engage in their healing process. So I'm excited to continue to bring this understanding forward and out there so more people can know how chiropractic can help beyond just
Yeah.
I have a kink in my back, right?
Yeah. I absolutely love that. Huh. Thank you all so much for taking the time to join us tonight.
Yeah. And if you have questions or you're like, how do, what you want to hear different topics, You can comment, follow us. We have our social media going at the Evolving Practice Pod. Drop us a follow and a line about what you like or what you want to see more of. And we are excited to continue to bring some fun stuff in this year of 2025, growth and prosperity and abundance to everybody. And we look forward to growing with you in this new year.
Happy New Year and have a great day.